Texas A&M University Health Science Center launched its Opioid Task Force in early 2018. Bringing together expertise from a wide range of disciplines, it's already succeeding when it comes to addressing the opioid epidemic through research, education, and community involvement.
Whenever you're faced with a crisis, you need to be creative.
Dr. Carrie Byington inspires creativity at Texas A&M University. The Opioid Task Force here includes faculty and staff from all 5 of the university's Health Science Center disciplines.
So those include the College of Dentistry, Nursing, Medicine, Pharmacy, and our School of Public Health.
Creativity also needs energy, and we found that here too. Dr. Joy Alonzo specializes in training and use of naloxone, the overdose reversal drug.
Call 911, give naloxone again, and I keep doing it until I run out of naloxone. And also call it when you're on 911, bring more naloxone.
Training is not just for faculty and staff, but all students as well.
We will be the first health science center in the United States to have every health science center student trained this year as an opioid overdose sign and symptom recognition and naloxone administration. So that will be a first. That's about 5,000 students. They'll each be issued their own kit, and the idea is that then they become advocates for naloxone administration and distribution in their own communities when they go to practice.
That's empowering to communities because the kits are comprehensive.
So you're going to get a nasal naloxone?
That version is called Narcan. There are vials of naloxone with needles, test strips to detect illicit fentanyl, a big reason for the spike in overdose deaths, and an auto-injector complete with voice guidance.
To inject, place black end against outer thigh. 5, 4, 3, 2, 1.
And even though this program just started, they've already saved lives.
We've actually had 5 reversals, 5 lives saved.
And they're quick to tell you here that that's just the beginning, as they identify specific needs in the community.
I'm Marcia Ori. I'm the chair of the Texas A&M Health Science Center Opioid Task Force. So the task force is concerned with advancing researcher knowledge, but it's also concerned about practice. What can we do in the community? How can we take what we know works with education?
Central to the task force is its Student Ambassadors program. It empowers the next generation of health professionals to combat opioid misuse during their education and translate what they learn into practice after they graduate.
The student ambassadors are at the engine that drives the whole thing.
It starts with us, but it doesn't stop with us. It's community-wide. That's what we're shooting for.
Caitlin Isles Clifton is a student leader of Operation Naloxone.
We like to think of naloxone like a fire extinguisher. If you don't use a fire extinguisher, the house is going to burn down. Same with naloxone. You don't use naloxone, the person's going to die.
She's also impacted personally by a family member's opioid use disorder.
Anybody can get their hands on opioids, and I think we stigmatize people that struggle from this disease as a certain type of way and a certain type of person, but it could easily be me, it could be you, it could be your next door neighbor.
There's a wave of students here intent on wiping out the stigma, and they know talking about the issue is a major step.
So I'm a person in long-term recovery, and having a supportive peer network has been instrumental to me throughout my recovery.
To increase supportive networks, Texas A&M held a screening and panel discussion of a Showtime docuseries on opioids in America. It sparked an outpouring of support and emotional messages from students, faculty, and the community. Those messages are now part of a wall prominently displayed.
People were so enthusiastic and open to leaving their comments. Part of what we're doing here in all of our interprofessional work is trying to reduce the stigma associated with opioids.
Interprofessional work and education is what the university is stressing while bringing together healthcare professionals, law enforcement, and communities, both urban and rural.
change the world, not only to change, the mindset here in Texas, but to change the mindset everywhere.
The Opioid Task Force at Texas A&M University Health Science Center believes in a holistic approach, addressing community issues through evidence-based solutions. Fighting to break down stigma around the epidemic, it translates research into policy that is helping to prevent and reverse opioid misuse. In College Station, Texas, I'm Craig Boswell.